I'm Dr. True. Tonight we're going to do the fourth part of my series on anti-aging. It is on hormone therapy. I think there are a lot of benefits to having a proper hormone balance. You're going to have an increase in energy levels. You're going to have less fatigue. You're going to have an improvement in your cognitive function. Your brain's going to think better. A lot of people, they complain of this brain fog. That tends to go away if you go on hormone therapy. Libido is better. Sexual performance is better. There's a decrease in body fat because you're building more muscle, and therefore your body is able to metabolize the fat. So there's a decrease in body fat. Now, is it going to make you lose a lot of weight? Well, only if you do a weight loss program. If you keep on eating wrong and not exercising adequate, you're going to keep on gaining weight. But it will help you if you do an exercise and good diet program to lose weight, because testosterone builds muscle, and that's going to increase your lean body mass, which will chew out the fat better. Of course, we all know about the fact that estrogen does decrease hot flashes and night sweats. So when you don't have that, you sleep a little bit better and you get better rest at night. It does another thing that's interesting. It strengthens your immune system. Bottom line is, it's going to improve your quality of life. So why not do some hormone therapy? And that's what our feeling is. And then things on the outside, you're going to see improvement of the skin, because as I mentioned, you have receptors of estrogen on your skin. It stimulates collagen formation. You have less of that aging to your face. With more collagen, you get a more hydration too, more fullness and thicker skin. So that results in, of course, less wrinkling and less aged look, more youthful look, and more of a youthful look of vitality. So when you look good, your mood is better too, and with estrogen, your mood is better. So if you improve your mood, you're going to improve the way you look too. Things you don't see, as we mentioned, heart disease is better. Estradiol kind of cleans the arteries out. It alters the biology of the vessel wall, so it's it is improved. It improves your lipid profile. You know, the cholesterol, we hear about cholesterol and triglyceride. If it's too high, it's going to increase your risk of heart disease. Well, estrogen improves your lipid profile. Estrogen alone will cause vasodilation, and it is an anti-inflammatory. All these things result in better heart, better health to your heart, and less heart disease. One other thing I do want to mention is that all these things have to do with a hormone called estradiol. It's one of the main three estrogen hormones. Maybe some of you heard about some other ones called estriol or estrone. Well, they also have some hormonal effects to them also. Estrone is the biggest part of the hormone in Premarin. Estriol is a different type. It's mostly compounded. But I do want you to understand that estradiol is the one that gives you all these benefits on the heart. These other ones do not. So I rarely ever use estriol or estrone, because I want to use one drug that does everything, and that's estradiol. So if you put this into perspective, there is an impressive large collection of biological data and observational studies indicating that postmenopausal hormone therapy protects against the heart and protects against stroke. Long-term studies of estrogen use is associated with a lower mortality rate, primarily through a reduction in heart disease, cardiovascular disease. Estrogen deficiency greatly increases mortality, death rate from cardiovascular disease. And over 90% of women will die from heart disease. And so we're giving you something to help prevent that. Over 40 years of study have shown this. So why wouldn't you want to take this to help your heart? It is the leading cause of heart disease is the leading cause of death among women in the United States, much, much greater than breast cancer mortality of women of all ages. Just more of the same confirmation that estrogen is good for the heart. Beginning estrogen near menopause is the best time to do it. Because if you do that, and you do it for a long period of time, women see about a third reduction in the risk of them developing heart disease. And if you take it for 10 years or longer, you significantly reduce your risk of heart attack. At the same time, there's no increased risk of stroke, cancer, DVTs, pulmonary embolus, as we mentioned. That's from that latest study, the Danish study. Decreased risk or at least equal risk of breast cancer, but a decreased risk of those bad things like stroke and DVTs. What about Alzheimer's though? A lot of people don't realize that if you stay on hormone therapy for a long period of time, you're going to reduce your risk of developing Alzheimer's disease. Well, none of us wants to have an Alzheimer's disease. Is there something I can do to prevent that? And yes, there is. You just go on hormone therapy for as long as you can. In the 59th annual meeting of the American Academy of Neurology, they showed that you can have a 46% overall decreased risk of dementia and a 64% reduction in the risk of you developing Alzheimer's. Pretty significant numbers. Estrogen reduces the risk of Alzheimer's disease by 50% in this study in JAMA, 2002. Big benefit of estrogen. And then osteoporosis is reduced pretty significantly. That's where you get the humpback, the loss of bone mass. If you just take estrogen, bone density is rapidly lost if you don't have hormone therapy. And if you have been taking it, then you stop, it goes back to being rapidly lost. But hormone therapy should be continued, therefore indefinitely, because it's going to continue to keep your bones healthy. And if you add testosterone, like I said, you can help to build the bone. Low testosterone in women is associated with an increased risk of mortality from cardiovascular events, low T. So if your testosterone level is low, you have a higher risk of heart problems. So why not get that up there too? That's not a bad idea. And that is independent of other risk factors. Testosterone is an effective and safe therapy for women who have heart disease, and it helps them out quite a bit. So what about the safety of testosterone in men? There used to be an old myth. High testosterone causes an increased risk of prostate cancer in men. That was an old myth. It's been around since 1949. And there was one study that talked about it, and therefore it's been like dictum. Everybody thinks that high testosterone levels increase your risk of prostate cancer. So a lot of people are afraid of getting testosterone. But think about this. Younger men usually have high testosterone. Do they really have prostate cancer? No. It occurs mostly in men as they get older, when the testosterone levels are less. So is that myth correct? Well, here's a nice graph. This graph tells you the age of a person, say around in their 40s, males, and the level of cancer of the prostate is on the bottom curve. And you can see it goes up as they get older. But the top curve is the level of their testosterone. And as you can see, high levels are associated with kind of a low incidence of prostate cancer, while low levels are associated with higher risk of prostate cancer. So the data now is totally showing that there's a difference in opinion. We have a shift in our thinking nowadays that we do not encourage low testosterone. We now encourage higher levels of testosterone. Higher levels are not associated with an increased risk. And if you think about it, I mentioned that testosterone makes you a lot healthier. Well, if you have low levels of testosterone, maybe your resistance is lowered. And maybe that's why low levels are associated with a higher amount of prostate cancer. But when you have like a healthy plant, so well-nourished, same way with a man who has adequate testosterone, well-nourished, higher levels of testosterone, they're healthier, resistance is not as low, less chance of prostate cancer. In addition to that though, one of the other things that they have found is that prostate cancer has a certain, or the prostate gland has a certain number of receptors. So you can keep going higher and higher if you want to, and it doesn't increase it, because once the receptors are full, it doesn't really matter. You can have all the extra testosterone you want. Just like watering a plant, you can have all the extra water you want, but it's not going to give it any more water. It's titrated to that level. So it is okay to take testosterone as a male. What about the heart? The lower the free testosterone, the more likely coronary artery disease occurs. Studies have shown this, so that actually testosterone improves your heart's ability to pump, there's less of this ST depression that's scientific term that says that your heart is a problem. But it dilates coronary arteries. It affects the lipids in a variable way, but most of the times it helps improve lipids to help decrease the risk of heart disease. It improves your body composition. We talked about that, more muscle. And the insulin resistance is better. And that has to do with metabolic syndrome and diabetes. When you become diabetic, you develop this thing called insulin resistance. Not all diabetics, but type 2 diabetes, they primarily have a problem with this problem of insulin resistance. And that means that your body doesn't want to, it's not as sensitive to the effects of insulin in your body. Therefore, you tend to not metabolize the glucose well, and where does it go? Right there. It goes right into your belly. You get that visceral fat. And that's the big problem. Testosterone helps to reverse that. Remember I mentioned testosterone decreases that visceral fat. And it also improves inflammation. One of the theories of aging is inflammation is increased. So if you take testosterone, there's less inflammation. And I did mention that testosterone does decrease arthritic type pains. Maybe it's because of this anti-inflammatory effect it has on this. And it helps the heart, less congestive heart failure. Interesting study. They did a 10-year prospective study on a lot of men, age 40 to 79. They found that if you had a high amount of testosterone, you actually had low mortality from cardiovascular disease. So, the opposite effects. Low testosterone would probably predict a higher risk of developing cardiovascular disease. High testosterone showed there's no increased risk of developing prostate cancer. It was the same risk. So this is paradoxical fear of prostate cancer has kept a lot of men from doing testosterone therapy, but it's really unfounded. It's that myth again that we talked about. There's a Swedish study, 30,000 men during this time, who receives medicine to stop testosterone production. As I said, they thought that, oh, testosterone worsens prostate cancer. So they took all these men and they reduced their level of testosterone because they were thinking they're going to reduce the prostate cancer. Oh yeah, well, guess what happened? They developed heart disease. And that's the biggest thing that kills them. 90% of the deaths is, for women and men is heart disease. So what did they do? Did they do something good? No, they found out that's not what we should be doing. Maybe we should be giving them testosterone, increasing it. Testosterone decreases your risk of dying. 41% decrease in chance of dying in men with a high level of testosterone compared to a lower level. Interesting. This is this study. For each increase of 173, the chance of dying went down 14%. Extrapolating out, comparing the T of 300, which is low, to a T of 1,000, there's a 57% decrease risk or chance of dying. So all you people, if you want your husbands to die, make sure that their testosterone is low. Or you want them to stay alive, keep them up there. Let's talk about some of the things, once again, that these hormones do. They decrease heart disease, decrease osteoporosis, decrease Alzheimer's, skin wrinkles go down, bladder problems are decreased, colon cancer is less, vaginal atrophy is less, you get an increase in energy level, less fatigue, you got less brain fog, more libido, you help metabolize the fat better, you build more muscles, there's less night sweats, you promote better sleep, strengthen your immune system. Why wouldn't you want to do it? Bottom line, it's going to increase your quality of life, both on the inside and the outside with minimal risk. So what we do, we offer bioidentical hormone therapy. That's what we prefer. It can be done in several ways. We actually kind of prefer the pellet method, where we insert these little pellets into an area. Usually it's back here. We numb up a little area, make a little poke hole, and we insert the pellets inside. It's estrogen and testosterone, but they're the bioidentical estradiol and bioidentical testosterone. We insert it inside, and for 3 months they last, and you get a nice level of hormones for 3 months, and all those symptoms that we talked about go away, and you get an improvement, and you just feel a lot better. We can prescribe creams. If it is, it's just estradiol. As I mentioned, I avoid the estrone or the estriol. because I want to have the total package. If I'm going to prescribe a drug, I'm going to make sure that the woman gets the max amount of benefit from that drug. And estradiol is the one hormone that has been shown to decrease all those bad things that can happen as you get older. The other ones have not shown it. They help in some stuff, but not in everything. Why not give you the good stuff? So that's my personal feeling. That's what I do. There are other systems like gels. There are tablets of estradiol, but as I mentioned, we try to not use those because they can slightly increase your risk of stroke. Hormone pellet therapy has been used for years. It's been in the literature since 1940s. They have never been shown to affect the person in a negative way. They are hormones that will help to increase your estrogen and testosterone level to a young girl, a young woman. And why not do that? Because that's going to give you the best vitality, the best benefit. You're going to feel the best. Because wouldn't you love to feel like you were when you were younger again? And hormones is a good way to start feeling that way, especially since there's no increased risk of breast cancer. And that's a big benefit. However, we do recommend that if you start hormone therapy, you should be medically monitored on a regular basis. And what we do is we check you. Like say, for instance, we put pellets in. Our goal is to try to achieve a level of a 20-year-old to give you that nice hormone balance. Well, we don't want to go too high. We mentioned excess can be a problem, but we don't want to go too low. We want to give you a nice level of hormones just like a 20-year-old might have. Therefore, what we like to do, we insert pellets, we check your blood work approximately 6 weeks after we insert the pellets to see, are you getting that level? Because of pellets, you'll get a nice level, it'll peak, and then it'll kind of go down after 3 months, then you come in for another course of pellets. Every 3 months is the way the pellets are administered. But if you get your hormone level right at the peak, and we can see where your level is, if it's at the right level, we got the right dose. That's how we know. We have to check. You can't just assume that everybody's the same, because let me tell you, they are not the same. Every woman is totally different. We have an average dose, but we have to titrate the dose. For men, it's every 4 months. We do a blood level around 6 to 8 weeks after insertion, but men, it lasts a little longer. It lasts for 4 months. Totally different system, totally different type of method that we do. It's both with pellets, but the male pellets do last longer. Just it happens that way. Here's what to expect if you were to do hormone pellets. If you have hot flashes, they usually resolve within 24 hours. Over the next few weeks after having pellets in, your symptoms of depression, decreased libido, they go away and they resolve. Over the next few months, your energy level gets better, you feel better, you have an improvement of your libido, your sex life is good, it's a lot better. Most guys, they tell me, husbands tell me, I don't know what you're doing, but I want you to keep doing it. And when you have the pellets, they totally dissolve at the end of the treatment period, and then the symptoms kind of tend to come back, of course. And then you need more pellets. But it is a way by which you can get both estrogen and testosterone in an easy, convenient way, as opposed to just doing creams every day, which you can do. We see this. Women like hormone therapy. They do like it. But they love hormone pellet therapy. It just is much more natural. It's like when we do pellets, we are implanting. It's like we are implanting little ovaries inside of you that slowly release your hormones over the next 3 months. And that's a more natural way to go. They like it. They get a little zip to their step, men and women do. So why would you use it? Because you're going to live longer, you're going to live happier, you're going to live healthier, and you're going to live with a better quality of life. So thank you very much for coming to my presentation. I kind of like this joke. Doctor said, you needed to find time to exercise and diet. The guy says, what? I thought he said, find a new Lexus and buy it. I liked it. I thought it was cute. So, questions?
How big are the pellets?
Very small. I don't know if you saw that one picture. They were right in the palm of the hand. They're basically this big. They're very small. Very, very small. Yeah. So you don't need a big hole. You just a little poke hole, and it's numb. We numb up the area and put a little poke hole and just put it in. They're pretty small.
Then how do you take the testosterone or the progesterone or the third one?
Oh, progesterone. I didn't really finish that one. Yeah, progesterone is a pill that you take. They can't make progesterone into a pellet. So if you like progesterone, if you want it, if you need it, it's a pill that you can take, or you can take a cream. You can use a cream. Actually, progesterone can be formulated in a lot of different ways. You can use it as a vaginal suppository or a vaginal cream. Most women don't like that too well, so they either go creams or tablets. But I mentioned, you know, progesterone can have some downsides. There are some side effects. There's some good things about progesterone. Do you really need progesterone? And this is a topic that's different between a lot of different anti-aging physicians. I've been doing hormone therapy since 1986, and I can tell you that a lot of women, they don't need progesterone. Those women who have a uterus need progesterone. If you have a uterus and you take hormone therapy of estrogen, you need the progesterone to counteract the effects of the estrogen on the uterus. Because if you just do estrogen over years, you could develop a uterine cancer. But if you add on to that progesterone, that increased risk of uterine cancer goes away. Now here's another thing that you probably ought to know about when you take hormone therapy and you have a uterus. If you're postmenopausal, well, I haven't seen my period in ages. Well, now I'm going to give you hormone therapy of a young 20-year-old. Well, what does a young 20-year-old have? Menstrual periods. So you might bleed because you get menstrual periods because I'm giving you that hormone level. So that's a downside risk. The truth is most people who have a normal uterus don't have a major problem with that. But if there's something wrong with the uterus, they start bleeding heavily. And it becomes apparent when we give them hormone therapy. Therefore, we do a procedure called a hysterosonogram to evaluate that. And it's not the most pleasant procedure, but it does evaluate what's going on. Why are you bleeding? And then from there, we can figure out whether we need further therapy. So if you're hiding something that could be potentially bad, that's not a good thing either. So it's not a bad thing to use progesterone while you're on the estrogen. But you take away the uterus. Let's say you had a hysterectomy. Do you have to have progesterone? If you like it, yeah. But if you like some of those people who get side effects, you don't necessarily need the progesterone. That's my opinion. It's different than some of the other guys out there. The way we do it is you come in, we put the pellets in. To start off, I give you kind of a moderate dose. We check your level at 6 weeks and see what it is. We check you at 3 months. You tell me what's going on. Because I don't want to treat you because of a blood level. I want to treat you because of what your symptoms are. And so say, for instance, you say, well, at 2 months, I started getting my hot flashes again. I'll look at your blood level. We didn't hit it. Let's increase your dose. So it's sort of a trial and error type of thing initially until we get you on the right dose. But once we got you on the right dose, it works well. Yeah. That's why we see you so often, because we want to get it just right. And women are very complicated. You know, we have both estrogen, testosterone, sometimes we need progesterone, and then those other things that I mentioned, DHEA, we talk about all that stuff, which I didn't cover tonight because it's a lot of information. But they're very complicated. Other questions? Yeah.
I just wanted to testify. I did do the pellet therapy for about a year, and I had never felt better. I mean, it was remarkable.
Yeah. Thank you for saying that. That's.
And my other half has just started doing this with me like 2 weeks ago. He's already saying he feels, well, he's 64, and he says he feels like 20 years younger.
Oh yeah, it's a major difference.
He's still waiting for the libido part to kick in.
Yeah.
But everything else.
Yeah, but the energy level. I see people when they come to me and they're depressed and they look frail, and then I put them on hormones. Within 2 weeks, man, they're out there doing things. Guys come in, I don't want to do anything. Women too. I just don't have the motivation. I used to do all this stuff. I just don't want to do anything. That's one of the biggest symptoms I see is they have no motivation. Give them testosterone, all of a sudden they're back. They're back at it. I'll testify to that myself. When my hormone level goes down, because I do hormone pellets, when my hormone level goes down, I tell you what, my motivation goes down too. I get the pellets, within 2 days I'm back. Oh, there's not an average gain weight. Most people don't gain weight. Yeah, most people don't. Some people do, but there's not an average. There's a lot of people who lose weight. Exactly, because if you gain muscle, you're going to look better. Your clothes are going to fit better because you're gaining more muscle. And of course, more muscle chews up more fat if you do exercise. So a lot of it depends on what you're doing with your lifestyle. Are you eating right? Are you exercising? You know, there's a lot of factors. A lot of factors. But some people do say, you know, I'm gaining weight. But I'll look at them and they look fine. I said, well, are your clothes different? Oh, no, my clothes are fine. But I gained this weight. Well, you're gaining muscle. You're looking better. Oh, yeah, that's great. That's what I want. Right. I like the pellets because you get a level that just goes up and it stays up. Like I said, it's like I'm implanting ovaries. It's convenient, and you always have that there. Creams, well, it kind of goes up on a 24-hour thing, and suppose you miss a day, then you start doing hot flashes or whatever, same thing, you know. So it's just easier with the pellets for the woman, and it's more convenient. Yes, it takes about 15 minutes, 10-15 minutes, and it's an office procedure. Yeah, you just come here, we numb it up, put it in, you go back to normal activities.
Okay.
Yeah, we cover it up with a piece of tape. You got to keep the tape on for a little bit because where we put it, it's kind of just below the belt.
Okay.
And well, we all wear clothes, and clothing can irritate it, and you get a little scarring in there. So we recommend you keep them covered up.
I can show you.
There you go. Yeah, so they get the soy base, and they convert it to through a process, and they make the estradiol that is identical to the hormone as a young woman has. Bioidentical. That's what bioidentical means. The philosophy of bioidentical hormone means that you're going to put the same hormones in you that a young girl has in the same amount. Because remember what I said, the FDA says, the FDA approved ones, they say, well, you should be on the least amount of hormone for the shortest period of time because the FDA still is concerned about breast cancer. Least amount of hormone for the shortest period of time. But I just showed there's really no evidence to support that if you get the bioidenticals. So therefore, our feeling is get the optimal levels like a young girl and do it as long as you want. If you stop, then you might have some of the problems that happen inside and the outside. The aging process can get worse. Oh yes, macular degeneration can happen over time. It's the #1 risk of blindness.
Does it actually improve?
If you go on hormone therapy, once you get a disease, it's hard to get it back. The best thing is to prevent it. I think most guys do recommend that you go on estrogen when you do it. Does it really help if you've had it? I can't answer that. I don't know. I'm not an ophthalmologist specialist, but I do know it helps to prevent it. Yeah. This is preventive medicine. It's improvement of quality of life. So people ask me, does insurance cover all this? Well, insurance is there for you if you have a medical problem. Well, you haven't had the problem yet because you're trying to prevent it. So this is preventive therapy. So it's not covered under insurance most of the time. Most of the time it's not covered under insurance. It's prevention. Do you want to help your body to stay younger? Quality of life issue. It's a quality of life issue. Do you want to have better quality of life?
The supplements, vitamins, that's just a plus.
That's another thing that you can do. And I'm going to talk about that actually next month, my next meeting of my anti-aging talks, the nutritional aids that you can do. And there's a bunch of stuff that you can do that really work well. Really work well. Huh?
So I have so many blue bottles.
I know, a lot of blue bottles.
Every time I come, I buy a new blue bottle.
Yeah, there's a lot of things, and that's a whole new topic that I'm going to do. I'm going to spend about an hour doing that next time. So stay tuned on that one. That's next May. Yeah. If you try it, it's an amazing difference. You feel so much better most of the time. Now, there are some people who we do pellets, do hormone therapy. I don't see any difference. Well, you know, that happens with everything. But what happens 90% of the time? They love it. It works great. They like hormone therapy. I mean, their quality of life has improved. Sex life is better. I've had people come to me and say, you know, Doc, you have saved our marriage. I mean, we were going down here, we didn't have sex for years. Now all of a sudden we're having sex almost every night. We love it, and our marriage is great. Hey, there's nothing wrong with a good marriage. Other questions? Well, thank you everybody for coming. I appreciate it. And